Good morning, and go Astros. Let me just say, they're gonna win. All right, they're gonna give me another ring like this one. This is a replica, but it works, and I got my Astros orange today. But listen, we're so excited on a number of fronts. We're excited for our Houston Astros. We wish them well. We know that they will represent the city in an incredible way, but they'll do an even better job for Harris County. And so, go Stros. And to that end, let me just say that the other reason that I am excited this morning is because we are making an important and incredible commitment to all people in Harris County. You know, one of the things that we have learned in this pandemic is that it can cause stress and anxiety. It can make people feel that they're by themselves, that they cannot engage their loved ones. And we recognize that this has caused stress and anxiety, depression, and other challenges. And so today is an opportunity to recognize that mental health is an extension of your overall health. And just like we have discussed other health issues or illnesses such as heart disease or cancer, it's just as important to focus on how someone is doing psychologically and emotionally. And let me just say that the excitement that I feel today about this particular initiative, Commissioner, it should be just as if we were announcing the cure to cancer. We should be giving and recognizing that mental health approaches and strategies and efforts and resources should be as excited as we were to receive the vaccine in our community. It's critical. Simply just ask anyone that you know that has lost a loved one to suicide. You know, I remember one of my first days on patrol as a Houston policeman. I met someone who regretfully had lost contact and with reality and was literally starving herself because she was waiting for her husband to come home. That husband she was waiting on in her mind was Ellis Presley. And then I remember my first suicide call. And it was never lost on me how we could not understand when someone who has served our nation or our community in uniform would also take their lives. But something else the pandemic has brought to a head is the critical need for access to mental health services in communities all across the country, including Harris County. And we're doing something about it. We are here to recognize that Harris County staff, along with the Harris Center and other partners, are acting to address our local mental health crisis. Today, we're excited to announce an innovative, truly community-based mental health initiative. We will increase access to mental health support and services. The Harris Center community-initiated mental health and resiliency care empowers and equips communities to help their neighbors. You know, to a certain extent, this is too simple, but it makes incredible sense to do. But the other reason I'm excited is that we've done a lot with our CARES dollars. We've done a lot, we're doing a lot with our ARPA dollars. You can see where we're investing that money in. Just look at the website, the Harris County website, and our transparency is obvious to how we're using those dollars. This is the first program funded by the American Rescue Plan outside of direct assistance and outside other programs that we've been doing, and its impact will last long after the pandemic is over. This initiative is strategic. The program focuses on 300,000 Harris County residents and zip codes disproportionately impacted by COVID and suicide, with a laser focus on those that either don't have access or don't know how to access mental health care. So with that in mind, let me just close with these points. The Harris Center will equip neighborhood leaders with training and tools that they need to help save lives. Wayne Young, our executive director with the Harris Center, will share more on how they will do that, but it will involve training in areas such as mental health first aid and skills development, so that folks like barbers and hairdressers, even family members of those who have a mental illness, will have the training to become mental health advocates. It's about creating a more empathetic and resilient community. And I'm very, very excited, and I want to applaud Mr. Wayne Young and his team for putting this together, giving it the thought. And Commissioner, I want to thank you for your support on making sure that dollars that we have, precious dollars, are well spent on everyone's overall health, including mental health. So thank you, Mr. Young.
Thank you, sir. Good afternoon. I'm Wayne Young. I'm the CEO for the Harris Center for Mental Health and IDD. And I want to thank Commissioner Garcia and Commissioner Ellis for this opportunity to announce this exciting new initiative. And to the other elected officials, community leaders, and interested residents, we thank you for being passionate and committed to this process as well. The Harris Center is a public agency charged by the state of Texas with delivering behavioral health services in Harris County to those most in need. As the largest behavioral health and IDD developmental disability center in Texas, the Harris Center provides a full continuum of behavioral health services in 83 locations across Harris County, serving over 80,000 unique people every year. We take our mission to transform the lives of people with behavioral health needs very seriously, and that's why I'm honored to announce the Healthy Minds, Healthy Communities locally led mental health wellness project made possible through a partnership with the Harris County Commissioners Court and the approximate $9 million potentially allocated by them through the American Rescue Plan Act, Coronavirus Local Fiscal Recovery Funds. The mental health impact of COVID-19 has touched almost every family in this country over the last 18 months. In fact, over 40% of Americans report symptoms of anxiety or depressive disorder right now. And this has shown a light on the behavioral health needs in our communities. While it's touched almost all of us, the burden has been inequitably distributed across age, gender, race, location, and social class. From employment to health to education, Harris County residents have faced additional stressors that have eroded natural support systems, leaving residents isolated and more susceptible than ever to behavioral health struggles. Prior to the pandemic, the investment in behavioral health was too limited and the behavioral health workforce was too short. More than ever, it's clear that we cannot simply create strategies of hiring more clinicians to try and reduce and address these problems. We must take an innovative step forward to lessen the negative impacts of the negative mental health impacts of this pandemic. This reality requires innovative approaches in meeting broader behavioral health needs in Harris County. For the next 3 years, with this strategic investment from the county commissioners and county judge, the Harris Center is working with the Wellbeing Trust and others to further develop and implement a project based on the community-initiated care model. It'll be in 10 zip codes here in Harris County that have been disproportionately impacted by COVID-19, suicide, and lower utilization of behavioral health services in our community. The community-initiated care model is not dependent upon licensed clinicians, but instead engages in mental health promotion, prevention, and low-intensity interventions delivered by non-specialized but trained healthcare workers and lay members of the community. Community-initiated care is a broadly inclusive concept of empowering individuals to learn how to respond to mental health and substance use issues and to take helpful action in the moment, real time. Specifically, the collective strategies will build resiliency and offer training, support, and education to those communities through a menu of services and categories that focus on education and training, skill development, caring contacts, and digital impacts. We're confident this initiative will help those disproportionately impacted by this pandemic, but we're equally excited about the potential for Healthy Minds and Healthy Communities to have an ever-growing impact across our communities, and one that will stand longer than just the time of this investment. It'll continue to benefit our community going forward. There'll be at least one team embedded within each county precinct area that is ready to listen, learn, and connect with you and your neighbors. We look forward to the important work of partnering with these communities so that they may guide this project and its impacts in their neighborhood. I also just want to say, if anyone who's listening is currently experiencing mental health impacts from COVID-19, you can contact the Texas Statewide COVID-19 Mental Health Support Line at 833-986-1919. This line is staffed here in Houston by Harris Center Crisis Line workers 24/7 and has supported thousands of Texans since this pandemic began. Thank you again for this opportunity, and we look forward to continuing our work together to transform lives in Harris County. And I will add the ghost rose as well. Commissioner Ellis.
Thank you very much, and thank you, Commissioner Garcia, for having us pause to do this press conference. Wayne, thank you for your work. Mental health is clearly a problem in Harris County, and it's been a problem for a very long time, and one that oftentimes has been overlooked. I'm proud to support this program. This is a massive investment. I was talking to Mr. Young earlier. I think it is the largest investment of this type concentrated into a community-based approach anywhere in the nation. Academics have talked about it. From the institute he made reference to in Harvard, but nobody's done it. So this is one where we will be the best practice. I appreciate the work of your staff, my staff, and others have worked with them. They've asked some very probing questions of Mr. Young. I know they have gotten on his nerve, but we are appreciative that we're going to have this program because of the Biden administration and the members of Congress that voted to give us this ARPA money. So it's important that it works. We have metrics. So we will make a decision as to whether or not we will sustain it with local funds down the road. 3 years, roughly $3 million each year is a massive commitment. I do want to point out that just like the virus, mental health issues are much worse for people of color. And oftentimes in those communities, people ignore them, they're embarrassed, they don't talk about them. I am proud that one of the zip codes that we will focus on, which is a priority, happens to be the zip code I grew up in Sunnyside, 77033. Although, as he mentioned, there will be a coordinator in each precinct. We're not trying to go and divide this money based on some political formula. We're going to spend this money where the problems are. Yes. So we're targeting those zip codes that we know have more of a problem. And then on a personal note, look, all of us probably know of someone who has encountered this problem. And Commissioner, the first suicide call I got that I can remember was a dear friend not too long ago. And every time I pass by his house, a place where I traveled with him, I think about signs that if I'd been better educated, if I had known more, I would have said something. So it is important to get those stakeholders in communities so that when they see something, not only will they say something, they will do something and know how to do it. So it's a good investment. Go Astros and go make this work. That's the challenge. Yes, thank you.
Any questions?
Where do the homeless fit in this program? Is it something separate?
Well, I'll let Mr. Wayne talk about the details, but no. Look, people are people, and we're concerned about all folks who are experiencing some degree of stress. And look, violent crime gets a lot of coverage. It becomes common knowledge. But when someone gets to the point in their day, in their life, that they take their life, it doesn't get the kind of attention that they deserve. And sometimes that person could be a homeless person. So this program, I have confidence the Harris Center already is doing their efforts in that regard. But again, this is an opportunity for us to lift up all aspects of health, including mental health, and ensuring that no one will go a day without realizing that in Harris County, we care about their mental health. So, Wayne.
Yes, sir. I will add that it's probably important to recognize that these are zip code based, and so everyone in that area will have an opportunity to engage in these skills. And as people in our community encounter people with mental health conditions, they'll be able to use those regardless of circumstance. I also would point out that this is a tremendous investment, but it's also not the only investment. The state has made investments. There are also future projects. I know that the Harris Center has received from the state several $1 million to be able to focus on improving access to behavioral health services for the homeless. So while that is complementary to this, we also certainly want to make sure that we fill the holes and that we don't have all of our investment in one strategy or one population that we're trying to target. And so there will be additional services specifically targeting homeless. But certainly if you think about a business who gets their employees trained in mental health first aid or one of these other strategies, as they encounter people about their business or in their community, they'll be able to engage with those and certainly utilize those skills in a way that's helpful. Thank you for that question.
Any other question?
Could I get a Spanish
Sure.
version?
Did you want me to do that?
Yeah, we are good. El comisionado Ellis. And let me just also add a quick point of why this is exciting. Think about it for a second. Harris County is home to the epicenter of medicine. But I'll challenge anyone to look around the community to see where those services are being provided. Think about it. If you know someone in your family that is struggling with cancer, MD Anderson comes to mind. If we have visitors that come to Harris County on a regular basis just to go to Methodist, and people know that. People know the medical center. But think about the last time we thought about that premier, esteemed mental health institution. It has long been the Harris Center, but we haven't really worked to make it a household name, and this is an effort to do that as well. Gracias, soy el comisionado Adrián García, hoy aquí con mi colega, el comisionado Rodney Ellis, y el director del Centro de Salud Mental, el Harris Center, el director Wayne Young. Hoy estamos anunciando que vamos a proponer casi más de $9 millones a un proyecto comunitario que se va a llevar a cabo en ciertos códigos postales para ayudar a aquellas personas y familias que están batallando con un aspecto de salud mental, sea depresión, sea muy emocionado, algunas otras enfermedades que muchos saben que están con cuáles están batallando, pero no saben a dónde ir. Entonces, la idea aquí es de darle a personas como los peluqueros, las personas que llegan a trabajar el pelo de las mujeres, las familias, los familiares de las personas que están sufriendo con alguna enfermedad de salud mental. Esto es un esfuerzo para darle una herramienta a estas familias y estas personas para ser personas que llegan a promover que tenemos recursos para ayudar a todas las personas en cualquier aspecto de salud mental, pero en particular para prevenir el suicidio. Aquí en el condado, esta pandemia nos ha enseñado que el suicidio, en particular dentro de las comunidades de color, latinos y afroamericanos, es más alto que cualquier otra comunidad. Entonces queremos llevar a cabo este esfuerzo para hacerles saber a las familias, a la comunidad, que no se nos ha olvidado, no están solos y que estamos aquí para ayudarles. También, where's your mental health hotline? También quiero compartir que si alguien ahorita está sufriendo con algún sentimiento y posiblemente están pensando en tomar su vida, antes, por favor, darle una oportunidad a la línea de apoyo para aquellas familias. Ese teléfono es el 833-833-8282. 3-986-1919. Le suplicamos porque ese teléfono está contestado por los elementos del señor Wayne Young y estamos contestando ese teléfono 24 horas al día, 7 días a la semana, y estamos allí para ayudar a cualquier persona que está sufriendo con algún aspecto de salud mental. Entonces, mira, es importante que cuando estamos hablando de salud, si hoy estuvimos anunciando que estamos curando el cáncer, lo tanto que estuvimos emocionados cuando nos llegó la vacuna para el COVID-19. Debemos tener el mismo respeto, la misma emoción de saber que estamos poniéndole atención y dólares, millones de dólares para ayudar a familias y a la salud mental de cada persona dentro de nuestra comunidad. Este proyecto va a estar enfocado en ciertos códigos postales donde los índices están más altos. El esfuerzo va a estar dividido por los precintos de cada comisionado, pero está enfocado en donde sabemos que sucede el problema. Gracias.
Gracias.